Hi, my name is Barbara McPherson, and today we're going to be talking about glomerular filtration rate and the forces that affect the GFR. Okay, um, so, but before we start talking about the GFR, we're going to kind of go back and do a little bit of recap on the anatomy of the urinary system, specifically the kidneys. So, the kidneys are a pair of bean-shaped organs that lie posterior and inferior to most of the abdominal organs. Anatomically, they are said to be in the retroperitoneal space. That is the space between your abdominal cavity and your back. The job of the kidneys is to filter your blood and to remove waste products in the form of urine. They also maintain fluid and electrolyte balance. And here you can see this picture on the left in the blue here is showing a picture of a pair of kidneys. And then one kidney is cut open so you can see the inside structures, and the other one is left whole. And then the picture to the right of that shows you where the kidneys are located in respect to the other organs. As I had said earlier, they lay behind, posterior to the rest of these organs. As you can see here, they kind of got them circled here. So they kind of start from around the top of the kidney, starts where the adrenal gland is, starts around the 8th rib, and then it goes down to around the 12th rib. So they're going to be about mid lower back. The kidneys, as I said, their job is to filter waste out. But what really filters the waste out of the kidneys is the structures that are inside the kidneys. And we're going to talk about those next. Okay, so this slide is showing you the kidney and the associated structure. So as you can see, the figure on the far left is the kidney, the whole kidney. The middle one is a nephron, and the last one is your glomerulus and Bowman's capsule, which is your renal corpuscle. Okay, so I have drawn a line here on the kidney in black to show you, to indicate to you that everything above this line is considered the cortex. Everything below this line is considered the medulla. So the cortex means the outer section of the kidney. Medulla means inner section of the kidney. Okay, so the nephron, let's talk about the nephron. So the nephron is the functional unit of the kidney. You have millions of these structures in your body. There's millions of nephrons inside your kidneys. And as I said, the nephron consists of the renal corpuscle and the renal tubules. Now, the renal corpuscle is made up of the renal capsule, or Bowman's capsule, and the glomerulus. That's the structure over here on the right. The white structure here is your Bowman's capsule, and this funny looking little structure that's sitting inside the Bowman's capsule, that is your glomerulus. And it's also made up of renal tubules. That's these, see where it's circled in blue? You see all these little tubes going up and down? Those are called your renal tubules. And they consist of a proximal convoluted tubule, ascending and descending loops, the loop of Henle, and the distal convoluted tubule. And so that's a picture of those, what they look like. Here you see I've circled in red here. That's of the picture of the nephron. That is that I'm circling that's denoting a glomerulus. Okay, so if you follow the glomerulus down from the bottom here, you'll see these little tubes that are all looped together. That's called your proximal convoluted tubule. It's proximal because it's closer to the glomerulus. And if you follow that down here, this first loop going down here, or limb going down here, is called the ascending limb. And then it loops right down here at the bottom. That's called the loop of Henle. And then it comes back up, and that's called the ascending limb. And then it's going to come up in here to the very top into these little squiggly lines up here. That is your distal convoluted tubule. Okay. And then it's going to come from there and drop right down in here to this long one, which is called your collecting duct. Okay. So now the next slide is just basically an image of a nephron again. And I have some of them labeled that aren't labeled, and some of them were already labeled. But this slide is just showing you the structures associated with the nephron, such as your renal corpuscles and your renal tubules. So the glomerulus here is showing the glomerulus here. So the glomerulus is a cluster of capillaries that sit inside Bowman's capsule. The glomerulus is known as the filtering unit of the kidneys, and their function is to filter blood plasma and produce glomerular filtrate. Once that's collected and pushed out with forces that we'll talk about in a few minutes, it's going to go into Bowman's capsule, and Bowman's capsule is going to just collect that filtrate, and then it'll pass it on into the tubules, which is the next section of the nephron. And as you can see here, I've labeled it. This is the proximal convoluted tubule, ascending loop, loop of Henle, the descending limb, and then the distal convoluted tubule, and then this is the collecting duct. And this picture just shows you that water goes in and out, urea goes out, ions go out. It's just showing you where along this nephron things are secreted and absorbed and reabsorbed. Okay, the next slide, we're going to discuss what exactly is glomerular filtrate. So glomerular filtrate is fluid from the blood that enters the kidney from your renal artery. It is pushed into the capillary walls of the glomerulus. Okay, it is similar to blood plasma, but it has less proteins in it. It is the substance that ultimately forms your urine. So basically, the glomerulus is where your blood is turned into filtrate. Then it is filtered or leaks out of the glomerulus through fenestrated pores and membrane layers in the glomerulus, and then it goes into Bowman's capsule. This slide is just telling you the composition of it, and it's just defining it that glomerular filtrate is the fluid within Bowman's capsule that is essentially cell-free and protein-free and contains crystalloids in virtually the same concentration as the plasma. It's also letting you know that it's free from blood cells, proteins, or protein-bound molecules such as calcium, fatty acids, and amino acids, because they're too big to pass through the little pores in the glomerulus. Only like glucose ions and water and things like that go through that. If something else is going through it and you're getting in there, you've got some issues, health issues with that. And we'll discuss some of that stuff later. Okay, so what exactly is glomerular filtration? So GF is a process where your kidneys filter excessive fluid and waste products out of the blood. It is the first step in making urine. So the waste from the blood filters through the glomerulus and into the tubules to be removed from the body. So said another way, the glomerular filtration is the bulk flow driven by hydrostatic pressure of the blood. This image is just kind of telling you, it's defining glomerular filtration is the transfer of fluid and solids from the glomerular capillaries along a pressure gradient into Bowman's capsule. This filtrate, you usually will produce around 125 milliliters per minute of this filtrate through your glomerulus. That's around 180 liters a day. Okay, and the next slide, we're going to talk about what's called glomerular filtration rate. Since you already know what glomerular filtration is and you already know what filtrate is, now we're going to talk about the glomerular filtration rate. So basically what that is it's a test that will determine how well the kidneys are functioning, how well they are filtering. The GFR determines the speed at which the kidneys filter blood from the glomerulus into the Bowman capsule. And this is done in like minutes. Okay. So put another way, it's the total amount of filtrate formed by the renal corpuscles per minute. Your renal corpuscles again is the Bowman's capsule and the glomerulus. Now there are three factors, as you can see over here on the right side of this picture, three forces that affect the GFR. One of the forces is called glomerular capillary blood pressure, also called hydrostatic pressure. Another one is called blood colloid osmotic pressure. You can sometimes hear it called oncotic pressure. And capsular hydrostatic pressure, or Bowman's capsule hydrostatic pressure. And again, this picture is just showing you the glomerulus with Bowman's capsule. And then it's showing you these forces. There's numbers here. We'll talk about those next. Okay. So I labeled this to show you that this structure here to the left is called the efferent arteriola, and this one to the right, the bigger one you see, is afferent arteriola. Okay, that's how blood comes in to the kidney, to the glomerulus, and then it'll filter all the way around, and some of it will come in here and go back out into the body. But so first we're going to talk about the glomerular capillary blood pressure, or glomerular hydrostatic pressure. Okay, this is the blood pressure within the glomerulus. It's usually around 55 millimeters per mercury. You see, like right there. This high pressure is due to the diameter of the arterioles, these that I was talking about. So the afferent arteriole allows the blood to flow at a higher arterial pressure, and the smaller efferent arteriole restricts the flow of blood. And this flowing freely and restricting will balance out the hydrostatic pressure that's in the glomerulus. So what this does is this force pushes the blood out of the glomerulus and into Bowman's capsule. This particular force, this glomerular hydrostatic pressure, that is the driving force behind the GFR. So what that means is the more pressure applied to the walls, the faster the GFR rate. Now, the second one here, the second force that affects the GFR is called plasma colloid osmotic pressure. Okay, this is the pressure that is caused by large molecules, particularly proteins, in the glomerulus. So what is happening is the proteins are trying to hold on to the water since they can't pass into the membranes, can't pass the membranes of the glomerulus. So your pressure and your colloid osmotic pressure is somewhere around 30 millimeters per mercury. And what it's going to do is it actually opposes the glomerular hydrostatic pressure. It will oppose. It's one of the opposing forces of the hydraulic pressure. And it's caused, again, by large proteins wanting to get through there, and it can't get through there, so it's putting a lot of pressure on it because it wants to retain that water, and that water is wanting to osmotically flow down and get away and get out of there. So the third force that affects GFR is called capsular hydrostatic pressure, or Bowman's capsule hydrostatic pressure. Now that is the pressure that is exerted within the glomerular capsule, and it goes against the fluid coming out of the glomerulus. So in other words, it pushes fluid out of Bowman's capsule and into the tubules. So the pressure exerted is somewhere, on this one, the pressure exerted is somewhere around 15 millimeters per mercury. This is also an opposing force on the glomerular pressure. So two of these forces, the blood colloid osmotic pressure and the capsular hydrostatic pressure, are opposing forces against the glomerular hydrostatic force. So basically what that means is that all three of these forces are out of balance. The glomerular hydrostatic pressure, that favors filtration, while the other two oppose filtration. So mathematically, what that means is that the pressure in the glomerular is 55 millimeters per mercury. The pressure, the pressure of the other two forces is 30 and 15, which equals 45. So that leaves a net balance of 10 millimeters of mercury. That is called your net filtration rate. So if you take your glomerular pressure and you subtract it from, if you take this pressure, which is your opposing or your favorable force, and you subtract it from these two forces, which are your opposing forces, what you are left with is your net outward pressure. These are inward pressures, that's outward pressure. And so what you're left with is net filtration rate, and that's around 10 millimeters per mercury. And so that's kind of what that slide is depicting. Okay. Clinically, GFR is tested to determine the amount, if any, damage that has occurred to the kidneys. This is usually done through blood work or urine samples in the doctor's office. So your doctor might check your GFR if you have a history of diabetes, which has a tendency to damage the kidneys. So this image here is just showing you the rates for the GFR and stages. Because that's how they determine kidney damage. They do it in stages. So the normal range of the GFR is 60 or higher. So if a GFR below 60 shows kidney disease, and you can see that on here. Kidney damage with normal kidney function, that's stage 1, 90 or higher. Stage 2 shows kidney damage with mild loss of kidney function. That's your GFR somewhere between 89 to 60. Stage 3A shows mild to moderate loss of kidney function. That's somewhere between 59 to 45 GFR. Stage 3B is moderate to severe. That means you have some loss of kidney function. That's 45 to 30 GFR. Stage 4 is a severe loss of kidney function. Your GFR is 29 to 15. At stage 5, your GFR is less than 15, and you are in what's called kidney failure. So, and many diseases and medications will affect this GFR rate, and we're going to talk about those. In a study conducted by Bauza and Malhotra, they discuss how their thyroid hormones have an effect on glomerular filtration rate. The condition hypothyroidism causes a reduction in GFR, and hyperthyroidism has an increase on GFR. So thyroid hormones affect renal physiology by offsetting the clearance of water, which in turn offsets the GFR. So this study focuses on clinical interactions between the thyroid and renal functions, and medications used to treat the disorders of the thyroid. The study discusses hypothyroidism and renal function. As stated earlier, hypothyroidism will increase the GFR. In this study, hypothyroidism increased the GFR by 18 to 25%. Hypothyroidism reduced the GFR by 40%. Drugs that are used to treat thyroid disorders have shown to cause issues with the kidneys, and kidney disorders can affect thyroid functions. Therefore, these two systems seem to interrelate with one another. So in this figure, you can see thyroid and kidney disease. You can see what the thyroid will do, or what kidney disease will do to functions of the thyroid. So in hyperthyroidism, you have an increased heart rate, an increased cardiac contractility, and increased cardiac output. And hypothyroidism, and this is all in the heart. You have decreased heart rate, decreased heart contractility, and decreased cardiac output. In the vessels, kidney disease will lower peripheral vascular resistance. In hypothyroidism, it increases peripheral vascular resistance. In the renal system, the urinary system, in the kidneys, it raises renal blood flow. Hyperthyroidism does. Hypo reduces it. Hyperthyroidism will raise beta androtic receptors in the kidney. Hypothyroidism will reduce beta androtic receptors in the kidney. In the glomerulus, hyperthyroidism raises the renin-angiotensin-aldosterone system, and in hypothyroidism, it reduces this activity. Hyperthyroidism shows an increase in filtration pressure and an increase in glomerular filtration rate, while hypothyroidism decreases filtration pressure and glomerular filtration rate. In the tubules of the kidneys, hyperthyroidism raises the tubuloglomerular feedback and lowers it in hypothyroidism. In hyper, it raises the tubular mass, the sodium-potassium enzyme, the NHE activity, and in hypo, it lowers the tubular glomerular feedback, it lowers the tubular mass, and it lowers the sodium-potassium ATPase, and lowers the NHE activity. And in both hyper and hypo, it lowers the urinary concentrating ability. So kidney disease has a direct effect on the functions of the thyroid gland, as you can see from this study. Okay, that's the end of my presentation, and thank you. In another article I read by Kaufman, Baste, and Knoll, it determined that the NSAIDs decreased GFR by constricting the afferent arterioles of the glomerulus, thus the GFR, and affecting functions of the kidneys. So, sorry, excuse me. So, drugs will have an impact on how your kidneys function and your glomerular and your GFR. It will have an effect on that. So I hope you enjoyed the presentation and you have a good day. Thank you.